an exciting episode of This Is Our Life. I'm gonna tell you here and now, when you have issues, like I have back pain. This is day 2 of it really bothering me a lot. When I get grouchy, I get upset, I get
a baseball bat.
Yeah. I mean, I'm like, no matter what, I have a heating pad on my back right now. If I don't keep it on my back, I hurt. I get up and go into the kitchen. We're trying to make Thanksgiving dinner for tomorrow. I stand up. I go fill up the cup with water. My back hurts. I've cried. I don't like crying, and I've cried because of the pain. When you have this kind of thing, you become willing to take measures you might not otherwise take. I mean, if I had a muscle relaxant, even if it wasn't mine, and as long as I had a pretty good idea that I wasn't overdosing myself, I would take it. You know, I mean, I would do my best to be safe. I had a tooth. It was a thing on the bottom, and for months and months and months afterward, slivers of the tooth were coming out. I mean, it was infected. It was oozing stuff. I went to the dental school in San Antonio, and you know, they looked at it and they said, "Oh well, you know, we can't give you an appointment for like, I don't know, a week or 2. Maybe it was a month. I don't know." I was in such pain. I was willing to do things that I might not have otherwise have done. And then when I finally got in there, they're dental students. One's like a senior dental student, the other's more junior, and they both look at my tooth and they go like, "Oh my gosh, you must be in pain." I'm like, "Yeah." Oh, I remember what it was. Wait, no, was it that? I went to Jim's, which is a restaurant in San Antonio, and I had a burger. I love hamburgers. And I had it with bacon, and there was a little piece of gristle in the bacon. And I bit down on it, my tooth just disintegrated. Didn't hurt, it just disintegrated. Well, years later, it got infected, and they pulled it out because the outer part of it was fine. It was the inside of the tooth that just crumbled, yeah. And you know, it got infected, and it was painful, and I would have been willing to do things that I might not otherwise have been willing to do. When I worked in hospice, we had patients that were on major pain medicine. I mean major stuff that if you just started dosages, that if you just started taking that amount right offhand, it would kill you. And there were actually doctors that were, "Oh, I don't want to prescribe any painkillers to you because you might get addicted, even though you're
head feel like it's going to split open at any moment."
Yeah, I mean, and you're a hospice patient. Come on, you're dying. You're worried about the person getting addicted to it. The person may be dead in a week. So, but we had doctors that we could, you know, have our patients go to or whatever, or something like that, that actually understood what was going on. But right now I'm willing to do things I might not otherwise be willing to do, because no matter what I do, it doesn't stop. I mean, I took, what was it, 2 ibuprofen, didn't do anything. Nothing. I mean, not even in the slightest did it do anything. So I can understand, when I'm feeling this way, I can understand how someone else when they're in pain or whatever the situation, they would be willing to do things they might not otherwise be willing to do. Well, I have bipolar. Well, I take my medicines. Well, I know what it's like not to be able to sleep. And just in order to sleep, if I didn't have my medicine, I would be willing to do things that I might not otherwise be willing to do. So, I don't know. It's just, when I'm trying to get in there and work on something, it's not like we just, thankfully Carolyn basically made the pie. Okay, I really didn't do anything. She did it.
You did the measuring though, and
well,
too much better than one.
Anyway, I mean, just standing there, I was hurting. And if she would not have gone in there and done that, it would have probably taken me twice as long just because of the pain. I come in here, I sit down, it still hurts. It still hurts. I have a heating pad on my back, and I still hurt. We have to. I see the doctor in January, is it?
I think something like that.
In January, and I hope this doctor can do something about this.
This is actually a real doctor.
Yeah, not a nurse practitioner. So I'm going on and on with this. I've already said everything I need to say. I'm just. Sometimes it goes away. It doesn't hurt like this all the time. It always hurts.
This is abnormally bad.
Yeah, abnormally bad, and I figure maybe in a day or two it'll get better. I don't know. I hope so. Anyway, y'all have a good day. Bye-bye.